Good morning, everyone. So my study was to look at the effect of cyclosporine A on refractive outcomes and epithelial remodeling post-topo-guided LASIK. Now we know that epithelial remodels itself to kind of smoothen the ocular surface. This may happen in cases of LASIK or keratoconus or any corneal dystrophies. But how this pattern of epithelial remodeling is changing in response to laser vision correction and its effects on the visual outcomes is something we don't really know. Now we know that cyclosporin A is an anti-inflammatory and immunomodulatory agent, and a lot of studies have shown that it improves the tear production, enhances sensitivity, and shortens the duration of visual recovery after LASIK. But is there a role of cyclosporin in epithelial remodeling which is correlating with better visual outcomes, or something we don't know, and that's what we wanted to look at. So we compared two groups of eyes undergoing topo-guided LASIK, one which was treated with cyclosporin A postoperatively and one which weren't, and we looked at the following parameters of epithelial remodeling, visual outcomes, and higher order aberrations. So this was a retrospective study conducted for a period of 12 months, and we had a group A and a group B arm, and we looked at the epithelial remodeling in two groups with an AIOS2025 of with looking at 25 sections. We looked at the visual outcomes with uncorrected and best corrected visual acuity and visual function questionnaire score, and we then looked at the higher order aberrations on a night race at a standard 4 mm pupil size. So we included all those patients undergoing topo-guided LASIK who were between 18 to 40 years with a mean spherical equivalent being less than or equal to -9. We excluded those patients with hypermetropic astigmatism and hypermetropia, any prior corneal surgeries, who had significant dry eye, prior use of cyclosporin, or any intraocular complications. Now, preoperatively, the visual acuity was looked, higher order aberrations from eye trace, epithelial thickness in 25 sections with an AIOS2025. And post-op, we collected the data at 1, 3, and 6 months. Post-operatively, we found that the mean age in both groups were comparable. We saw that both groups had similar preoperative sphere and cylinder, and the spherical equivalent of the two groups did not show any statistical difference. When we looked at the epithelial remodeling in the central as well as 3 concentric zones on AIOS2025, what we found is that there was a progressive thickening seen from the baseline, that is pre-op to 6 months, mainly in the central and the inner zones. The overall absolute epithelial thickness was less than pre-op for the middle and the outer zone. But as you can see, each of these zones was behaving very differently from pre-op to 6 months, and we didn't really understand whether was this epithelium becoming more uniform or not. And we wanted to know whether is there a uniformity that changes from baseline to the 6 months, and does it impact the visual outcome, and for which we derived a single measure, which is the epithelial uniformity index, and this metric quantifies the uniformity by penalizing the variability relative to mean thickness. So here onwards, when we use EUI as the index, you should know that the higher the value, that is towards 1, the higher would be the uniformity of the epithelium. So we now then looked at the two groups and looked at the epithelial uniformity index, and we found that there was a decrease in the EUI from baseline, showing that the uniformity drops after topo-guided LASIK. But what was interesting to note is that this EUI still remained very less at 6 months. So it shows that the epithelium never really recovers to its preoperative value even at 6 months time period. When we looked at the EUI across the different zones, we found that there was an equal drop in the inner and the middle zone, but there is a minimal change in the outer zone. Now this shows that the change in the epithelial uniformity was driven by the LASIK ablation zone, which is mainly centered in the inner and middle zone and not affecting the outer. We looked at both group A versus group B and looked at the uniformity index, and it showed very similar results like I showed before, that the inner and middle were affected and not so much the outer. Since both these groups were behaving individually very similarly, we have combined the graphs to show you a better correlation between EUI and other parameters. So we wanted to look and understand what is it that is changing or driving this decrease in uniformity, and we found that those eyes who had higher refractive errors experienced more change or reduction in epithelial uniformity. And at 1 month, when we looked at multivariate modeling, the EUI was mainly influenced by the spherical equivalent and the total higher order aberration. We also found a weak negative correlation between uniformity and uncorrected visual acuity at 6 months, and coma and uncorrected visual acuity shows a significant negative correlation, which means that if there is lower uniformity, the patient will experience greater coma and slightly higher logMAR, that means a lower vision. There were no correlations seen between the other parameters which we analyzed. When we looked at the visual outcomes, we found that group B, which is the cyclosporine group, showed better visual acuity, more number of eyes with more than 6.5 visual acuity. At 6 months, group B showed more eyes with line gain as compared to group A. Group B did better with respect to the visual functioning score as well as the OSDI score, but only the VFU was statistically significant. The higher order aberrations, Group B showed better, but they were not statistically significant. And the change in higher order aberrations from 6 months to 1 month was shown to be greater in Group B. That means there was a greater reduction of the total higher order aberrations, considering it was a topo-guided LASIK, and this change was statistically significant. So to conclude, the epithelial uniformity index is a good way to look at the changes which are affecting the corneal epithelium post topo-guided LASIK, and probably most other refractive surgeries, as epithelium is what we are changing. And epithelial uniformity decreases at 1 month, remains low right till 6 months, which is a concerning trend because post LASIK, and we need to look at long-term studies to actually see how and when does it ever recover. Lower uniformity is more common with higher refractive errors and those with higher total higher order aberrations. Lower post-op uniformity leads to slightly lower vision and higher coma in the short term. Again, long-term outcomes will be needed to be looked at. And adding cyclosporine to routine post-LASIK patients does not seem to help with epithelial uniformity, but it does give marginally better vision and ocular comfort, and its mechanism of action post-LASIK needs to be studied in further detail. Thank you so much.
Interesting topic. So finally, cyclosporine didn't stand any chance to do any alteration in the inflammatory mechanism.
So we've not really looked at that part of things because it has been well established that of course it does reduce the post-operative inflammation. We kind of looked at a different arm completely where we wanted to know, does it correlate with the visual outcomes? Does it correlate with the changes in epithelium? I'm sure if you would have looked at how it affects the inflammation or even the tear film, it would have scored better. But that's not the perspective we wanted to look in this study.
So, but then that's an established fact that the epithelial healing will be much dependent on the ablation,
exactly.
on the powers.
Oh, you mean the refractive error?
Yeah.
Yes, but there has not been any study to my knowledge which says it that yes, it is the use of this or the use of a higher ablation causes direct association with the change in the epithelium. We know that there will be more progressive thickening, maybe this is our assumption, but studies have looked at the mean epithelial thickness. So that is something which we also looked at review of literature. Most studies have said that yes, there is a thickening. The mean epithelial thickness in central zone would be much more if you do a higher refractive error as compared to the other. But an overall uniformity was not something that has ever been looked at.
So what was the gadget you used for mapping it?
We looked at the AIOS2025. We looked at all the 25 sections from the central, inner, middle, outer zone. And each of these sections, we also have the mean epithelial thickness. But looking at those 25 sections separately didn't really give you a picture of was it more uniform or was it disparate. If you map them on a color-coded image, some of them looked uniform, some of them not. But that was not a very good subjective method to look at. So
I guess the epithelial mapping machine we have now would be more promising and would validate more.
Probably. If they use some sort of a statistical analysis like this, we would get it in a single measure that is it uniform or not. Thank you.